Hello and welcome back. In this video, I want to go over the key resources for remote practice. There are many more resources that will be available to you in Community, but these are where you should start. You may already be familiar with these if you've worked in remote practice previously. We will be discussing the assessment form, which was created by a remote nurse, and we're using it with permission from her. We will be reviewing the BCCNP decision support tools, as well as the First Nations Inuit Health Branch's clinical practice guidelines for nurses in primary care. Finally, we will be going over the BC formulary that was referenced earlier in the Scope of Practice module. These 4 references will assist you in your assessments, help define your scope of practice, and form the basis of practice expectations. And what I mean by this is, when we do charting audits or evaluate your practice, your history, physical, diagnosis, and plans will be evaluated based on these documents. First, let's talk about the assessment form. Many stations have these in the desks in each exam room, but it's a good idea to print yourself off some copies to have on hand. The idea is that when you bring a patient into the exam room to assess them, this will help you remember important aspects you'll need to assess. You can use it to keep your notes on as you move through your history and assessment. As you can see, it also is organized into SOAP charting format, which we'll talk more about later. Secondly, let's talk about the BCCNP Decision Support Tools, or DSTs. These can be found online as well as in binders in each of the stations. If you have your Remote Certified Practice designation or your Contraceptive and STI Management designations, these determine your scope of practice. If you do not have your remote practice designation, you will still be using them to guide your history, assessment, and planning. These are your first stop for each patient encounter. We will talk more about how to use them and the clinical practice guidelines in conjunction with the formulary later on. Next, the clinical practice guidelines, or CPGs. The DSTs only cover a narrow range of the health conditions that people can present to the clinic with. As an example, if you have checked the DSTs online, you'll notice there's no section at all for MSK. So if you have a client come in with a health concern that cannot be found in the decision support tools, and please remember the decision support tools are where you need to check first, you will need to access the CPGs. They are also found online as well as in binders, but it's strongly recommended you access them online as they're currently undergoing revision and the most up-to-date content is online. They're formatted in a similar manner to the DSTs, with the added advantage that they also have sections on when to consider a medevac, since they're written with remote practice in mind. They also have sections for treatment of some urgent emergent conditions, again with recommendations of when to consider a medevac. Keep in mind that things you may not consider sending out to a higher level of care where you work normally may need to be treated with a higher degree of caution in remote areas. These guidelines, in addition to appropriate consultation, can help you make these decisions. Finally, the BC formulary. As we previously noted in this course, these contain treatment codes A to E for each medication in the clinic. We will go over using them later in conjunction with the DSTs and CPGs. Again, these are the 4 resources that will form the basis of your practice in remote areas.